Have you ever looked at someone in their 80s or even 90s and wondered, how are they still moving so effortlessly? How are they still going for walks, climbing stairs, even gardening or dancing, when others their age are struggling just to stand up from a chair? It's tempting to chalk it up to good genetics or pure luck. But what if I told you that luck has very little to do with it, and that the true reason lies within something most people ignore until it's too late? Right now, there's a silent issue inside millions of aging bodies across the United States. It doesn't hurt. It doesn't scream. It doesn't show up overnight. Instead, it slowly chips away at your strength, your balance, and your ability to live independently. The scary part? You probably don't even know it's happening. What we're talking about is vitamin D deficiency. And before you dismiss it as something minor or irrelevant, think again. This isn't just about vitamins. This is about your muscles, your bones, your ability to walk, stand, lift, move, and live the life you deserve. And the truth is, if you're over 50, your chances of being deficient are shockingly high. Some studies estimate that over 60% of older adults in the U.S. have insufficient levels of vitamin D. Many don't find out until they've already fallen, fractured a bone, or lost significant mobility. Let me ask you this. Have your legs been feeling more tired lately? Do stairs feel steeper than they used to? Are you avoiding activities because your body doesn't feel as strong or steady? These aren't just signs of aging. These could be symptoms that your body is running low on an essential nutrient that keeps your muscles firing and your bones from breaking. But the good news? You can do something about it, and you can start today. Vitamin D is often called the sunshine vitamin because your body naturally produces it when your skin is exposed to sunlight. It helps absorb calcium, yes, but it does far more than support bone health. It plays a crucial role in muscle contraction, immune support, energy levels, and even your mood. And as we age, our ability to produce vitamin D naturally declines, while our need for it only increases. Here's a scenario that plays out in millions of homes across America every year. An older adult is walking through the kitchen, maybe carrying groceries or heading toward the couch. They lose balance, slip, and fall. Sometimes it's minor. Sometimes it results in a hip fracture. Sometimes it means they'll never walk the same again. And often, it's not a result of carelessness or a clumsy mistake. It's because their muscles were too weak to react. Their bones were too brittle to protect them. And behind it all, a silent vitamin D deficiency was making everything worse. Still skeptical? Let's look at the research. A study published in the Journal of the American Geriatric Society found that older adults who took vitamin D supplements had a 23% lower risk of falls. Another study, in the Journal of Clinical Endocrinology and Metabolism, showed that low levels of vitamin D were directly linked to slower walking speeds and reduced leg strength. It doesn't stop there. The New England Journal of Medicine reported that vitamin D supplementation could reduce hip fracture risk by up to 22% in women over 65. That's not a minor benefit. That's life-changing. But here's the twist. Most people with low vitamin D levels have no idea. That's because the signs creep in so slowly. Fatigue becomes normal. Leg cramps are brushed off. That nagging joint pain is chalked up to getting old. Meanwhile, your muscles are losing strength, your balance is slipping, and your risk of falling is climbing higher every day. So, how do you know if you might be deficient? Common signs include persistent fatigue, leg weakness, bone or joint pain, slower wound healing, frequent infections, and even mood swings or low-grade depression. If you've experienced any of these, your body might be trying to send you a message. Now, here's the part that gives you back control. There are three main ways to increase your vitamin D levels: sunlight, food, and supplements. Let's start with sunlight. Your body needs direct sun exposure, without sunscreen, for about 20 to 30 minutes, several times per week. The best time? Between 10 a.m. and 2 p.m., when UVB rays are strongest. But let's be honest, not everyone gets that. Maybe you live in a northern state. Maybe you work indoors or stay covered. And even if you do get outside, aging skin produces less vitamin D than younger skin. So that brings us to food. Fatty fish like salmon, sardines, mackerel, and tuna are excellent sources of vitamin D. So are egg yolks and fortified foods like milk, yogurt, orange juice, and some plant-based milks. Even mushrooms can contain vitamin D, especially those exposed to sunlight. But getting enough through diet alone is hard. That's where supplements come in. Doctors typically recommend that adults over 50 get between 600 to 2,000 IU of vitamin D3 per day. D3 is more effective than D2 and better absorbed by the body. And here's a crucial tip. Always take it with a meal that includes healthy fats. Why? Because vitamin D is fat-soluble. It needs dietary fat to be absorbed effectively. But there's one more piece of the puzzle most people miss: magnesium. That's right. Your body needs magnesium to convert and use vitamin D properly. Without it, all that sunshine and all those supplements might not be doing what you think. Foods like spinach, almonds, pumpkin seeds, quinoa, and dark chocolate can help. If your diet lacks these, consider adding a magnesium supplement too. Still with me? Good. Because now comes the exciting part. What happens when you actually fix the deficiency? In just 2 to 4 weeks, you might notice that your legs feel less tired. Your energy increases. Your balance improves. That tightness in your calves or thighs, it starts to ease. By the 8 to 12 week mark, you may notice you're walking more confidently. Getting up from chairs feels easier. You're doing more, moving more, and, most importantly, falling less. In fact, studies have shown that maintaining healthy vitamin D levels can reduce the risk of falls by up to 31% and improve muscle strength by 35% or more. Let that sink in. One small adjustment in your daily health routine can completely change how you move, feel, and live. Now, if you've been thinking, this all sounds good, but I probably don't need to worry about it, let me offer a quick reality check. Over 60% of American seniors are vitamin D deficient. That means more than half of people over 60 are unknowingly putting their health and independence at risk. The risk is real, but so is the solution. Here's a question to think about. When was the last time your doctor checked your vitamin D levels? If you don't remember, or if it's been more than a year, it's time to take control. A simple blood test can give you the answers you need. And once you know your levels, you can build a personalized plan to improve them.